Hello, everyone, and welcome to this week's edition of Ask the Expert. My name is Ashley Baldwin from the Department of Communications at the Pan American Health Organization here in Washington, D.C. And this week, we're going to be talking about tobacco use and COVID-19. I'm joined by two special guests. The first, Dr. Sarah Amami, who works in tobacco control at the World Health Organization in Geneva. Hi, Sarah. And I'm also joined with Dr. Francisco Armada Perez, Regional Advisor for Tobacco Control at the Pan American Health Organization, also here in Washington, D.C. Hello, Francisco. How are you?
Hello, Ashley. Hello, Sarah. Hello, everyone. It's a pleasure to be with all of you today.
So as per usual, I have a few questions that I want to ask Sarah and Francisco, but if you have any questions related to tobacco use within the context of the COVID-19 pandemic at any point during the next sort of half an hour, 40 minutes, please don't hesitate to put them in the comments section and we will get to them as soon as possible. So anything at all. But let's just start off a little bit. We had a Facebook Live and Ask the Expert session a few weeks ago on non-communicable diseases. And one of the main messages that came out of that Ask the Expert was that non-communicable diseases are a risk factor when it comes to severe cases of COVID-19. And two of the main things that we should be doing is stopping tobacco use and eating healthily. So given that, can you tell me a little bit about whether and why smokers are at higher risk of getting COVID-19?
Well, first of all, it will be important to say that we are really starting to study all the impacts and all the evidence in this regard. So we don't really have enough evidence at this point to really point out regarding the risk of having a higher rate of infection for the people who smoke. What we can say is that the smoking, the act of smoking itself implies a close exchange between the hand and the mouth. Of course, that it increases. It will be obvious to assume that will increase the chance of having somebody who touched on an infection area, or somebody who it will have a higher chance of having that relationship. Let's remember that the people who smoke, they have that act of going back and forth between the mouth and the hand with the use of the smoking product like around more than 300 times a day. So it really will increase that possibility. At least it is something plausible in that case, although it will be important to point out that there are not specific, or at least I'm not aware of specific studies looking at that at this point. Also, when the people use this, there are some products like the shisha or the water pipes. So when they use these products, they might be exchanging some of the parts of the use of these products, so that could also facilitate if somebody who has infection is using it and pass to somebody who is who doesn't have it. So that might facilitate that situation in that particular case.
Okay, I hadn't actually thought about the other tobacco products besides the cigarettes, the shisha and things like that. I guess if you're constantly exchanging amongst different people, of course, there's going to be a bigger chance of spreading the droplet transmission that we're constantly talking about in the Ask the Expert sessions.
Thanks, Ashley. Thanks, Francisco. I just wanted to add that, of course, in addition to these risks of transmission you have, especially if you might be sharing e-cigarettes or sharing water pipe, or even using chewing tobacco, you're increasing the risk when you spit. Also, of course, smoking decreases our lung capacity and our ability to fight off infection. So that's another thing that we're concerned about.
So we've also, we've discussed a lot that people with pre-existing conditions, people with diabetes, people with hypertension, et cetera, are much more likely to get severe cases of COVID-19 if they do get the infection. Are there symptoms, if I was a smoker, if I used tobacco frequently and I picked up COVID-19, would it be more probable that my symptoms would be more intense than someone who doesn't use tobacco products?
Well, I think that we're still waiting for a lot of evidence about this, but smoking does impair lung function, and it does make it a deal more difficult for our bodies to fight off infections. So we need to think about what it does to immunity. And WHO's advice here, of course, is that it's best to think about cessation, about quitting smoking.
That's a key advice. That's a crucial advice. So for anyone who smokes, for anyone who is smoking, it's any time is a perfect time for quitting smoking. But this is even a better, much better time to quit smoking. Like if you are considering it, this is a pretty good time. If you quit smoking, you will get benefits. Only 20 minutes after quitting, you will start to get the first benefit. So there is nothing to lose. To the contrary, there is a lot to gain. There is a lot to obtain in terms of your health, and not only of your health itself, but also in terms of the people who are around you. So we've been stressing over and over again, this is a perfect time for stopping to smoke, for stop smoking. And we have several tools and several aids in order to do that. So if you visit our web pages like both at WHO and PAHO, you will find a lot of tips and a lot of advice, and also like in the information page of several of the Ministry of Health in the region, you will find a lot of advice on how to quit a smoke. And this is really a perfect opportunity to do that. It will certainly give you a lot of benefits. And recently WHO launched like a artificial intelligence tool. I don't know, Sarah, if you would like to comment on that, but this is really an amazing tool that will help a lot the people who want to quit smoking.
So this is something that I can access that will help me quit smoking if I'm thinking about quitting. Oh, okay.
Yes, this is called Florence, and maybe we could give some information about this in the comments so that anybody interested could access this. But this is an AI tool to really help you individually in as many ways as we can. We really encourage you to try it.
It's really an amazing.
How does it work? So I'm looking. Let's assume that I'm looking to quit smoking, and I'm accessing this tool. How is it going to help me?
It's really first of all, it's very interesting. It looks like a digital health worker actually. So you can interact and you can talk to her, and she will provide you with what we call brief advice on quitting smoking. And this tool is specifically framed within the COVID-19 situation. So the COVID-19 situation was exactly the framework in which WHO worked to launch that tool. At the moment, it's available only in English, but it's going to be soon available in several other languages, the official WHO language, including Spanish, which is very important for our region. And it acts like you are talking with like a person. Actually, it's really amazing. We are going to be. I hope we can share the link in.
We'll put the link in. We'll put
Great.
The link in.
So we invite like everyone, even those who even that people that they don't smoke, we invite them to access that because it's very interesting how you can interact. She will be giving you some specific advice on how to quit, how to settle a date. She will be sharing some of the benefits. I was commenting that you will get benefits from the 20 minutes after you smoke until the 10 years after you stop smoking. So she will be giving you the specific. And what I find also very interesting, very useful about this tool is that it will give you a specific links to where you are. Like if you are in one of the, let's say you are in Jamaica, or it will provide you several of the tools that are available in that country that will aid you to quit smoking. So it's really a very interesting tool. Of course, it doesn't include all the options that the people have for quitting smoking, but it provides like an entry point, a very interesting entry point into quitting smoking. So we invite all of you to visit that tool, and also, of course, we are really, we have a lot of expectation of having that artificial intelligence health worker speaking Spanish and several other WHO language very soon. So
that's
please.
brilliant. It's great that it contains local resources as well, you know, for quitting at a country level. We've actually just shared the link in the Facebook chat, so you can access that from now onwards. And we're also sharing a guide for tobacco users to quit. So you now have 2 tools at your disposal. There's no excuse to continue using tobacco products. And as Francisco mentioned, we can start to see the benefits even within 20 minutes of cessation, of quitting smoking. So we've spoken a little bit about people that use tobacco products themselves, but what about those who don't smoke but who live with people who do? So do we know anything about potential risk factors when it comes to secondhand smoke and the transmission of COVID-19?
We, again, it's kind of a new disease, and there are several studies that are undergoing currently. So we don't have, or at least I'm not aware of any specific study looking at that. But for sure, if somebody is using the act of smoking, it's also promoting the exchange and the transmission of that person is a carrier of the virus. It's very likely it will promote that. And what probably is more important, and for that we have tons of evidence, is that the exposure to tobacco smokes have terrible and awful consequence to everyone's health. So it's not only that it's plausible to have that to favor that kind of infection, but it's also the issue that being exposure to tobacco smoke will have a very bad impact on health, including from death to several diseases, and that is pretty well documented. That's why we insist on promoting cessation, but that is also one of the reasons that we insist on adopting smoke-free policies. This is one of the key measures for tobacco, for the control of the tobacco epidemic. So, and this is included in the Framework Convention for Tobacco Control as one of the key measures. So we've been promoting the adoption of regulations among the countries and to have smoke-free environments in all the enclosed, at least in all the enclosed public and working places. And that will help a lot. It will help a lot for the people's health, and of course we believe it will help also not only the people who smokes, but the people who doesn't smoke in this case.
Of course. So I'm joined here by Dr. Sarah Amami from the Tobacco Control Team at WHO in Geneva, and also Dr. Francisco Armada Perez, Regional Advisor for Tobacco Control at the Pan American Health Organization. And today we're talking about tobacco use in the context of COVID-19. We can see that several of you are connected, but if you have any questions for Sarah or Francisco, please don't hesitate to put them in the chat. Now is the time, and we will answer them live. Until then, we've spoken about smoking. You know, I guess when someone, a journalist, thinks of tobacco use, the first thing that I think about is, you know, smoking cigarettes. But what about electronic cigarettes or vapes, products like that? Sarah, can you tell me a little bit about, you know, does the use of those products have the same risks when it comes to COVID-19 as manufactured cigarettes?
Sure. Thanks, Ashley, for the question. Thanks, everybody, for being here, for joining us today. What we do know about electronic nicotine delivery systems, ENDS, which is how WHO refers to it, is that these devices do increase the risk of heart conditions and of lung disorders. And a little bit earlier, Francisco was telling us about the increased risk of transmission. And because you have the same motion, this hand-to-mouth motion where you are exposing your face. And so because of both of those things, I think it's plausible to be concerned about the use of these devices, especially during COVID-19. You might be increasing your risk of infection because you are adding more hand-to-mouth movement, and you may be impacting your heart and your lung function. So as always, this is a time to think about cessation.
And of course, every time we mention about any other tobacco products besides the traditional ones that we are familiar, is also a very good time to insist that all tobacco products have a risk for health. So this is a very important point to insist. Of course, the amount of evidence and the amount of evidence that we have for different products is not the same as for the conventional products, but all tobacco products impose a risk for health. So there is not evidence that any of them will not impact on health. So that's a very important reminder that we have to keep insisting over and over again.
So I guess we're not just asking people to quit smoking manufactured cigarettes. Our message is you need to stop all of these tobacco products, or the use of all of these tobacco products, particularly when we're faced with a global pandemic of COVID-19, which is affecting people's respiratory health and causing respiratory symptoms.
Certainly, certainly that's the situation. We always say that it's an excellent time for quitting smoking, but at this point it's an even more excellent, if that's possible, time for quitting smoking. That's why we've been insisting strengthening these several tools that we have to help the people to smoke, but we also have been insisting to provide technical aid to the governments in the region in terms of how to implement policies to strengthen cessation services. So we've been looking at several interesting experiences in several countries in the region that they've been increasing their online service for quitting smoking. Not only the tools like we were talking about, like Florence, that it's recently available, but we can see, like, for instance, in Costa Rica, they are, at this point, they are increasing the services that they have through bots or through several message systems that they allow and they facilitate the people to quit smoking. This is only one country, this is only one example of among several initiatives that are going on in the countries. And we've been trying to provide technical advice on how to increase that and how to do it better. There are several interventions for quitting smoke that have proven very effective. So we've been also promoting the use of quit lines, having quit lines as an interesting option and a crucial option as part of the service, having a line where the people can call, hopefully for free, and get some advice on how to quit smoke and get some advice on the available service for quitting smoking.
Right.
Right. So just to recap, you know, you're increasing your risk of transmission, and any kind of tobacco use is increasing your risk for lung or heart damage.
Okay, so stop the manufactured cigarettes, stop the vapes, stop the chewing tobacco, all of it. We've had a question come in from Antonio Cons, who wants to talk a little bit about big tobacco and the impact that advertising is having on newly developed tobacco products. You know, what's our stance when it comes to advertising tobacco products, and particularly at a time like this, you know, during a global pandemic where, you know, people's respiratory health is being hugely compromised?
Well, thank you, Antonio. This is an excellent, a perfect opportunity for us to comment on the importance of having a total ban on tobacco advertising, promotion, and sponsorship. without any doubt, the tobacco advertising and promotion and sponsorship is a critical tool for the use of tobacco. Is not only a tool that they keep the people using tobacco, but it's also a tool that the tobacco industry use to recruit new users. So it's critical, and this is one of the key interventions that the Framework Convention for Tobacco Control includes, banning tobacco advertising, promotion, and sponsorship. So it's we have to emphasize the importance of having that ban. At this point, we have 8 countries in the region out of 35 who has this total ban. Several others are moving forward towards having that also that total ban. We provide and we encourage the countries to do that because that's a crucial element. And sadly, we've also been witness and we've seen several of the attempts of the tobacco industry or some of the allies of the tobacco industry to take advantage of any opportunity, sadly, even to take advantage of the COVID-19 opportunity to promote their products, to promote the different options of how products can just to promote the products. And this is really awfully sad that they take advantage of this opportunity. That is why we insist on having a total ban on the advertising of all tobacco products by any means. It will be and also promotion and also a sponsorship. Because of that, we also have several kind of regulations, including the Framework Convention of Tobacco Control, to counteract the tobacco industry interference. But this is certainly a crucial point that we have to insist.
Brilliant. And what about vapes? Because we're certainly seeing sort of increasing, especially amongst youth, primarily increasing advertising and targeting of younger populations when it comes to vapes, including as a way of quitting smoking using manufactured cigarettes. So I wonder, we have a question from Chio Loyola, who wants to know a little bit about the risks of vapes on lung health. So it's well documented what the risks of cigarette smoking are on lung health, but what do we know about vapes specifically, Sarah?
I think that we could provide you a little bit more information in the chat about the impact of vaping, of using electronic nicotine delivery systems on lung and heart health. This is a really rapidly evolving field, and there's considerable publications in the area. So we'd be happy to provide you with some of WHO's most recent resources on that. I don't know if Francisca would like to add.
Well, there is increasing. There are a lot of studies going on regarding that topic. So we keep monitoring these kind of studies, and one topic that has been documented is how the use of electronic cigarettes is being kind of a bridge particularly for the youth to go from electronic cigarettes into the conventional cigarettes. So it's been an entry point, and that it goes back to the issue that we were discussing about the importance of having bans on tobacco advertising and promotion chips. So this is one of the issues that have been documented, and it's important to insist on that particular issue. Exactly because of that, there are several recommendations in terms of several approach on how to regulate these new products. So like all the countries that they take part in the Framework Convention for Tobacco Control, they have produced several advice on how to better regulate this new set of products. But the recommendation is, so they have regulation for some countries, they have some recommendations of different options to regulate, but the recommendation is for sure to regulate.
Okay. We also, during the previous discussion that we had on non-communicable diseases, one of our experts mentioned that some studies were showing that there had been an increase in the use of alcohol during lockdown and while people are physically distancing, et cetera, and we've just had someone who's posted on the chat, a study, I don't know if WHO or PAHO is aware of it, saying that cigar smokers are smoking more during the COVID-19 pandemic. I wondered, what are our recommendations when it comes to cigars? Is it the same as manufactured cigarettes and vapes that, we need to implement these control measures? Is it different for cigar smokers? What are the particular risks when it comes to a regular cigar smoker getting COVID-19? Or would they be theoretically just as susceptible for severe disease as a cigarette smoker?
Thanks, Ashley. I would say yes, absolutely. Cigars are tobacco products, and they are very harmful to health. They raise the same concerns in terms of heart and lung health, among other issues. And they raise exactly the same concerns in terms of transmission that we've been talking about, that whenever you're engaged in this activity where you're touching your face a great deal, you're having this hand-to-mouth contact, that you are increasing your chance of contracting COVID.
Yes, and I will add that also as tobacco products that they are we have to apply the same regulations that are included for any other tobacco products in the Framing Convention of Tobacco Control. So all the regulations apply exactly the same. Again, there is this COVID-19 is sort of kind of a new situation, and there is a lot of evolving evidence going on. And I've seen some studies that they have reported like increased use of some tobacco products, while other studies have reported the opposite. Also, we need to point out that the conditions in different contexts are not quite the same, so that probably will have an impact. But the advice is exactly the same. Quit using tobacco products. This is a perfect time for quitting smoking. This is a perfect time for quitting tobacco, the use of tobacco products, and you will get benefits to your health almost immediately after quitting, and it's an excellent time to do that. And what is also very relevant to the context of that we are experiencing is that the lung function and the lung health will improve after quitting smoking. So that's certainly something that we all want our lungs to be working properly in this context of having a pandemic of a lung disease. So that will be very, very important. And actually, we probably will to mention, and this is regarding COVID-19 and smoking, that what's been documented is regarding the severity of the cases, and that's several studies have documented that the smokers are more likely to have a more severe situations regarding COVID-19, and that's been documented in several studies and several meta-analysis that has been done. So I would say we should invite the people to review a scientific brief and a section of question and answer that we have published in our webpage, where we have like very specific tips on that. But it's been several of the meta-analyses that have been done, and until this point, they have documented that smokers will be more likely to have a severity the situations regarding COVID-19 than those who are non-smokers. So that's a crucial element that we have to point out.
Okay, so it really is, there has never been a better time to quit using tobacco products than now during the COVID-19 pandemic. So as we get to the end of this session of Ask the Expert, I wanted to get down into the nitty-gritty. We've spoken a lot about the risks. How specifically can we protect populations from tobacco in the context of this pandemic? What are our main asks to governments?
Well, I will say there are several interventions that governments can do, but I would like to focus on three, or maybe on four. Well, first I would say this is a excellent, a great time to strengthen tobacco control and not to do the opposite. It's a great time to strengthen all the regulation, and it's a great time to go and to aim at the full implementation of the framework, the Convention of Tobacco Control. It's a perfect time to do that. We call for that in all conditions, but now we really are stressing and highlighting that call.
And when sorry to interrupt you, Francisco, but just for our audiences, if they don't work in the health sector, when we talk about implementing the Framework Convention for Tobacco Control, what are we tangibly asking governments to do?
And the Framework Convention of Tobacco Control is this international treaty that includes several measures in terms of tobacco control. It's and it's kind of very important to clarify that. It has several sets of several interventions, including that. And at this point, there are three that are critical. One, it's smoke-free environments. Enforcing smoke-free environments is really critical. So this one of the key interventions in that sense is to have smoke-free environments, at least in all the enclosed public and working place. And this is really fundamental and critical. Fortunately, we have 21 countries in the region that they have adopted those regulations. We still need several more to go. We have 35 countries in the region, but this is one of the critical interventions, so we are calling for that one. The second one, as we've been insisting during this talk, not enough, but we've been insisting, is cessation. We have to strengthen cessation services. We really have to strengthen the availability of cessation services. It's like, so several of the governments, they have a lot of a menu of options, and we have to keep working on having several alternatives for the people who want to smoke, and to promote that the people want to smoke, to make it more accessible. And well, we were mentioned several of the options during this talk, but this is a second key intervention, including the Framework Convention, that we have to stress. And there is another intervention that, of course, we aim at having a combination, not having only one, but we aim at having a combination. But this one itself has been documented to have a lot of impact, and is raising the price of the tobacco products. And the governments have a critical tool to raise that impact, which is the taxation. So we are really calling the countries to increase the tax on tobacco products. It will have really we say a win-win-win situation, because all the impacts are positive. At some point, it will help the people, it will discourage the people to the use of tobacco products, so it will have an impact on, it will have a clear impact on their health, because they won't be using the tobacco products. On second hand, it will have an impact in terms of all the costs that the use of tobacco implies for the health services, and all the costs that it implies because of the, not only of the healthcare, but also in terms of productivity, because of the people, they don't go to the work because they are sick. And finally, it will also become, and this is not the main aim, but it will also become an additional source of revenue of this very well need, increasing need for revenue for the government. So it will have really, it's a situation that we all win. So we are calling all the country for increasing the taxes on tobacco products as a clear public health intervention. We are not talking about a fiscal intervention, but as a public health intervention, as it is clearly specified in the Framework Convention for Tobacco Control. There are several other measures in the Framework Convention of Tobacco Control. We already talked about having a ban on the tobacco advertising and promotion and sponsorships. We are also been insisting on the importance of having health warnings, and this is also a key intervention for tobacco control, and there are several others. But at this point, I would like to take, in the context of the COVID-19, I would say the overall strengthening of tobacco control policies making sure that the people have smoke-free environments, at least in closed public and working place, increasing and strengthening the cessation services, and raising the prices of tobacco products, usually by taxes.
Brilliant. So I just have one final question for you both, and maybe Sarah can start. So there are clearly these huge advantages, not just for lung health in the context of COVID-19 and protecting ourselves and our families against getting severe disease, but also, you know, longer term benefits in avoiding some of these awful diseases that that are more likely to impact people that use tobacco. So we're really sort of pushing cessation, and when we talk about cessation, we mean quitting. What exactly can I do during COVID-19 pandemic? What should be my first step, Sarah, if I want to quit smoking?
So now is a great time to think about quitting, and you should do that no matter what kind of tobacco product you're currently using, whether that's conventional cigarettes, whether that might be cigars, chewing tobacco, or e-cigarettes. We would really ask you to do that. And remember that we have other messages. Please don't share devices. Do think about the risks that you are sharing with those around you. In terms of your first steps, I would think I would go back to our new artificial health worker, Florence, and really encourage anyone who even has questions about quitting, about some of the associated benefits, to follow the links and to have this conversation, because this is an amazing new tool. Francisco?
And I guess that will direct people to resources in their local areas as well. Perhaps some of the
It absolutely will. It will direct you to local resources. So that's a WHO resource. But of course, we would also encourage reaching out to local resources.
brilliant.
That's it. There are several steps, and of course, it depends on the context. But usually, when the people start that journey for quitting smoking, it's very important to set a date for that, so that day can be like a special event, maybe like a birthday or special event. Of course, if your birthday has just happened, it won't be advisable. It won't be like the best option, but it kind of you settle a close date to start when you're going, maybe within a couple of weeks, and also making your environment cigarette free. So getting rid of the ashtrays, getting rid of and of course it's also very useful when you are starting the process to share with your friends and co-workers the journey that you are that you are about to embark, because it will be very useful to have their support. And another advice that we have, another recommendation that we have for the people who are starting that process, is to try to avoid those places and those situations that trigger smoking in them. So, but as Sarah was pointing out, this is one of the specific tools that you can easily get from our Florence friend, digital friend, and also through several of the web pages. So we really invite everyone to go into that journey of quitting smoking. And again, the COVID-19 reminds us the importance of taking care of our health and avoiding so many risk factors and so many situations that might endanger our health situation. So it's certainly a perfect time.
Brilliant. Well, thank you so much, Sarah, and thank you, Francisco, for joining us on this edition of Ask the Expert. We'll make sure that we have all of the resources to the quitting tools that were mentioned in the comments if they're not there already. And please feel free to have a look at WHO and PAHO's websites, where there'll be a lot more resources about tobacco use, not just within the context of the COVID-19 pandemic, but certainly importantly at the moment within that context. We will be back next week, same time, same place, for a next edition of Ask the Expert in the context of the COVID-19 pandemic. So please don't hesitate to join us then. Thank you so much, and we will be back soon. Thank you. Bye-bye.